My journey through dentistry has been quite a ride. Grew up in New York City, trained on the East Coast, was interested in dentistry, went to dental school at Columbia University in New York City. And then right from graduation, went upstate to Rochester, New York for orthodontic residency. I started out as an associate here in El Paso, Texas, and worked as an associate for about 3.5 years. And at that point, I really wanted to have something on my own. So I was looking into practice transition. It just so happened that I found a practice that was had the best reputation in town, and I decided to try to pursue that opportunity. And we had to build up the practice. There was no Invisalign treatment at the time being performed at the practice. I had to bring in Invisalign treatment. And we really grew the practice, I'm proud to say, to the point where I felt like I wanted to expand. So I was looking into a second practice location on the east side of El Paso and found a doctor who was also closer to retirement age and was interested in a transition. So I pursued that opportunity and was able to acquire his practice as well. And so now we're growing on both sides of town, on the east side and the west side of El Paso. Bonnie and I really had to spend late nights in the office. So it was a lot of hard work and dedication to see the practice develop and grow. And there are nights I can tell you that we were extremely worried about whether or not we would make it. But I think we're proud to say that we came out pretty strong and was able to grow both locations. We were at that point, actually, during 2020, an OSO did reach out to us and ask us if we were interested in partnering, and we went through all the numbers of the practice, the financials, and at that point, we were advised that now's not the right time for us. Like that, we could be acquired. However, most doctors at that point probably would have some regret. So if we could grow the practice even more and reevaluate in a few years, we would be in a much better position.
I think the reason why we decided to seriously consider an OSO is because we were at the point where we had grown as much as we can. Jesse was floating between two offices, seeing pretty much the maximum number of patients that he can on his own. So we came to a point where we said, okay, if we want to grow more, which we did, we need to either, hire another associate, or which can be difficult, especially being in a smaller city like El Paso. It is hard to recruit orthodontists to come to El Paso and stay here. So we thought, okay, well, if we do join an OSO, they can help with that growth, and we still have room to grow. It's just figuring out how to grow as a small business is a lot more work and more scary than having an OSO behind you with the resources, the support. They help with staffing, they help with, collections, all the things that you have to do as a small business. Now, even things like search engine optimization is so difficult, marketing, you have to answer reviews. There are so many things that are required in a small business now that you're stretched pretty thin, and it's difficult to do everything really well. So at that point, we said, let's consider an OSO to help with that support and to help with the growth that we knew is still out there and that we wanted to, achieve, but kind of wanted some help with it.
I felt like when we were introduced to Seven Pillars that they had very good knowledge of the market conditions and even the characteristics of each individual OSO or DSO. They knew pretty much how to play matchmaker. I felt like they knew different practice models and doctor personalities, and was able to recommend certain DSOs and OSOs that they felt would complement that practice. So I really appreciate their knowledge base in the OSO DSO market.
I think the important thing to us was to not try to go it alone. Clearly, this is what Seven Pillars does day in and day out. They are the experts. It was going to be probably the biggest transaction of our life. And just like when you go to buy a house, which is a fairly large transaction, you wouldn't try to do all the paperwork yourself without a realtor. You rely on the realtor and they're the experts in the business. So this was, to us, we wanted somebody who does this, knows the in and outs, knows how to negotiate, knows different things that you should ask for so that they could help us throughout the entire journey. And they were excellent. We had heard horror stories about when you go through this process, it is, you're asked for a lot of information, and a lot of times the doctors don't know that information. They're not involved. They don't know how to pull financials, or they don't know how to run reports. And so a lot of the doctors had warned us, it's a really tedious and hard process. You're going to hate it. For us, personally, it was not a tedious, terrible process, which I think for some practices it is. We're lucky in that regard that, Jesse handles anything orthodontics related. I handle anything financial related, and it really went very smoothly. And Seven Pillars helped us as well. They were very organized. They were kind of the intermediary as well. So for us, it was not a difficult process. It was smooth. We felt comfortable. We never felt really overwhelmed or anxious or anything like that.
But the process is such where with each OSO, you have to pull different reports and you have to do things a little bit differently. So it is a lot more work if you're just trying to, put out feelers and seeing, who's going to bite and who's going to make an offer. So we fortunately agreed to hear out the offer of one particular OSO that Seven Pillars highly recommended for us. And that process was actually very smooth. I do feel weights lifted off my shoulders after the acquisition. I'm able to see patients without, in the back of my mind, worrying about collections or what benefits are the employees looking for. That's one less or two less or 100 less things I have to worry about. So it just is freeing to be able to perform orthodontics without having to worry about a lot of the business aspects that normally myself and Bonnie would be responsible for.